Hello friends and colleagues, my name is Harleen Sani. I'm the Medical Director of Tuberculosis Clinic at Santa Clara County. I wanted to take this time and opportunity to talk about tuberculosis in California and most importantly in Santa Clara County. March 24th is designated as World TB Day in the honor of Robert Koch, who discovered TB bacteria. And this was back in 1882. And to this day, we have not been able to eradicate this disease, which is preventable and treatable. The essence of this day is to take a pause and educate and learn and to see what is in our capacity to help towards get the goal of ending TB. WHO's motto of 2024 is, yes, we can end TB. We all have a role in getting towards this goal. And if we are a medical provider or a patient or a parent or a caregiver or anyone else, in the last few years since COVID started in 2020, California has seen a steady increase in the number of TB cases, and it is now almost back to the pre-pandemic level. This means that we are getting better in connecting patients with the medical care they need, which had become a major problem during the pandemic. Given our county is very diverse in nationality and ethnicity, it is important to remember some facts. Number one, people born outside the U.S. bear the biggest burden of tuberculosis, a consistent pattern over many years of more than 80% of TB cases being seen in people born outside U.S., mostly Asia and Mexico. Number two, there are still ongoing disparities due to race, ethnicity, and if anything, these disparities are actually increasing. There's also a big taboo connected with tuberculosis which needs to be broken to get people who are at the highest risk to get connected to the care that they need. Number three, people with medical problems such as diabetes, kidney disease, HIV infection, and other conditions that make their immune system weak are at significantly higher risk of getting active TB disease. Number four, TB is preventable. More than 2 million Californians have latent tuberculosis, and out of these, unfortunately, only 1/5 are aware of this diagnosis, and about 10% have been treated. This is the main reservoir of the TB disease which needs to be tackled. So I urge my fellow colleagues to think about tuberculosis when talking to their patients, depending upon their risk factors, and also urge general population to ask their providers if they need to get tested. Thank you.
Hello everyone, my name is Jaspinder Man and I'm at TB Clinic. As Dr. Sani mentioned, World TB Day is observed annually on March 24th to raise awareness about TB and efforts to end the global epidemic. Tuberculosis is a curable and preventable disease, yet worldwide too many people suffer and die with it. TB is the second leading infectious disease killer after COVID-19 worldwide. Santa Clara County had fourth highest case rate among all California jurisdictions in 2023 and number one in all Bay Area counties. Santa Clara County had 19% increase in TB cases rate with reported 168 new TB cases in 2023. Santa Clara County also have a big reservoir of latent tuberculosis infection cases, estimated about 170,000 people. Individuals with latent tuberculosis infection, if they are left untreated, may become sick with TB disease within weeks to year after becoming infected. About 85% of TB disease patients come from the progression of latent tuberculosis infection. TB is preventable with LTBI testing and treatment. We have a strong need to raise awareness so people can ask questions, get LTBI testing and treatment, and remove the stigma around the TB disease. This is our first World TB Day at our brand new facility, Valley Health Center Lundy, House of TB Clinic and Refugee Health Assessment Program. TB Clinic at Santa Clara Valley Healthcare System provides expert evaluation and treatment of active TB disease and preventive therapy for latent tuberculosis infection. TB Clinic provides treatment to approximately 60% of all active tuberculosis cases of Santa Clara County and is also a successful provider of latent tuberculosis infection. Again, the 2024 theme from World Health Organization is, yes, we can end TB. We must think, test, and treat cases of TB disease and prevent the spread of the infection. Please join hands with us in the journey of Eliminate TB. Thank you.